All these days you might have heard classical presentation, excellent presentations from the academicians. I think perhaps I'm the only clinician so far presenting here. Am I audible now? Okay.
Yes, sir. You're audible, sir. It's all okay.
So the way the narration, the explanation, or the presentation might be lagging in some theoretical explanations like textual reference or something. So you may kindly expect rather a clinical experience from this presentation. I hope you will come to that line of understanding. Thank you so much. So this is actually to incorporate age-old Ayurveda regimen and simple medications in day-to-day life. So this is mainly to give you an idea about how to preserve our health, especially eye health, and improve our natural eyesight before getting into very serious disorders, very serious eye permanent illnesses which can affect your vision and eye health as a long-term going process. So this is to make some awareness among the public, not only public, on Ayurveda general practitioners, because unlike modern counterpart, Ayurveda general practitioners, once they come to know that it's a specialty case, they generally just leave the case and they say, I do not know much about it. So that sort of line they approach. So here, this is mainly to give a basic understanding on general examination of the patient for either to manage himself in the clinic, or if it is not readily able to do the management to the stage to know when to refer the patient to a specialist. So that sort of awareness is aimed in this presentation. So you might have seen these various seasonal challenges which happens in the eyes, also in other general conditions like the pandemic, what we are going through. All these situations, how to handle them with a minimum stock of management techniques and medications with us. So this is a one second. This is just briefly a picture of doing how this. You might have seen the image of Tarpana in many websites and various resources. But perhaps many of you might not have seen this kind of picture, which uses only very little amount of black gram powder and very effective cooling of the medicine over the eyes with less time in making the border of the tarpana eyes, and also with a large quantity of ghee, the medicine can be poured into this. It's very easy to use, easy to dispose, and less irritating the patient. And it is more economic too. We need a piece of paper to support the wall, unlike keeping very wide masha powder paste in the face. Okay. So this is a demo. I'll just show a demo about it. Are you able to see that?
Yes, sir. We can see that. Yes, sir.
He is very skeptical.
one practical just to show you the
At home, I take Triplan E, 1 spoon every day.
method of doing the kasana. I hope you understand how to make it now. Okay. This is another Kashaya Dhara. Below the okay. And what are actually the preventive ophthalmology? What are the benefits actually you get out of this preventive ophthalmology? So as you see the slide, the diagnosis prevents actually the progression and help preserve one's vision mostly throughout life. Early detection prevents huge expenditure in future. And a lot of embarrassments may be avoided because once the disease becomes very chronic and manifests in a very higher form, it's very lots of embarrassments can be avoided if the patient comes to know about it when he goes to a general practitioner, and the general practitioner is able to identify some of the problems what we can show to the patient that you are susceptible to this such kind of eye disease, you are susceptible to such kind of problems, so that can avoid a lot of embarrassment in the future. And the future onset of visual disturbances or other ocular pathology may be avoided or its severity is reduced. That also can be done very judiciously with the presence of mind by the general practitioner. So, what are the things which you are almost able to guide or understand from your day-to-day practice in a general OPD? Okay, the strabismus or squint, or what you call exotropia, esotropia. If you call it exotropia, the eyeball is diverted out to the outward movement. And if it is esotropia, eso means inward movement of the eyeball. And if there is a hypertropia or hypotropia, hypotropia is below. One eyeball goes below, and another hypertropia means one eyeball goes up, and the other keeps the visual pathway and alignment. So both the eyes are not aligned properly. That becomes a squint. So some of the small spins you may not be able to identify. The patient may not be able to identify. So the important factor, what you need to understand while in seeing a patient, that you have to closely watch the patient's eyes from the center point and see whether you are able to, whether the eyes, both eyes are aligned together to see that object. Sometimes there may be a slight change from the towards outward. Sometimes it may be inward. So that sort of changes you are supposed to understand by seeing a patient's eye. Then also you have to have an examination of the eye examination. Eye examination has to be done with absolutely with a single eye, not with both eyes. Eye examination should always begin with mostly with the covering the left eye. And if the patient is wearing a glasses, you have to remove the glasses first and have an eye examination without glasses. Then you have to ask the patient to cover the left eye with the patient's palm, not the finger, because fingers may have gaps in between that. So that makes a lot of difference in eye examination errors it causes. So you have to ask the patient to not very tightly cover the eyes, rather very loose. It has to be just covering the eye. so that the patient doesn't see through that eye at all. You have to particularly see that if the patient is whether holding the hand like this or just like this. It is not. It is to be avoided. It has to be done properly with crossing the eye through the nasal level, and absolutely you're not able to see through that covered eye. Okay, then that vision has to be marked up. And you have to similarly ask the patient whether the least line or the smallest thing is possible through left eye as well. Left eye and right eye does have the same vision. If you do not have a chart, no problem. You can just have an overall general examination whether both eyes are equally visible. That is called lazy eye. When one eye is, in many cases now we find out, come across the patients like lazy eye or amblyopia. So in that amblyopia means the one eye is not functional. Every structure, eyeball structure, its optic disc and its retinal macular layer, optic nerve and optic sheath, everything will be all right. But the patient will not have vision in one eye. That is called a lazy eye, the inactive eye. So you have to always do the examination with one eye closed, and each eye you have to monitor how the vision is. So suppose if the patient says that you are having problem with your left eye, and when I covered the right eye, I'm not able to see. That is a time to refer the patient for a detailed checkup with the eye specialist. And macular degeneration in early or age in children, sometimes early adulthood, there will be Bett's dystrophy will be there, macular dystrophy will be there, iridomacular degeneration will be there. So those can be identified in simple examination, vision examination, whether by just without any equipment, without any tools or examination equipments, you can always identify a patient whether he is having a severe eye vision problem related to refractive errors, or if he having any retinal pathology behind it. So that needs to be identified. That is very base of the treatment, in which way we have to approach the patient for the management. So you have to have a clear idea about how to proceed with a refractive error and a retinal pathology. So a simple technique can be used when you use eye examination, vision examination. That's called a pinhole. Just take a small piece of paper or just smaller rectangular paper and make a dot pen, a small dot in that. So that makes a pinhole. So many of you might be knowing that the physics say that pinhole technique, pinhole camera. The refractive error or refractive index is nullified through a hole. That is, there is a lens means two prisms based on the joined together, and it's called a lens. When two prisms are added, the base of the prism makes the central principal axis. So the pinhole actually nullifies this prism value, and it actually passes through the principal axis. It uses the technique of passing through the light is allowed only through the principal axis, that is center of the prism, center of the lens. So there won't be any power. So when there is a patient coming and if he is not able to see, you have to first of all identify whether the patient is having only a lazy eye like refractive problem with that eye, or whether he has a retinal pathology behind it. So identifying the retinal pathology over the refractive error, if the patient is improving his or her vision while looking through a pinhole, we ask the patient to look through a paper which we have pierced and a hole is made. If you ask the patient to look through that hole, the patient will be able to see more letters. If the patient is able to see more letters, that we can definitely assume that it is nothing to do with a retina problem or macula. Rather, it is a mere refractive error in that eye. So that can be managed in a different manner. If there is a retinal detachment, or if there is a retinal degeneration, optic disc degeneration, glaucomatous changes, this pinhole effect will not be benefited. The pinhole will not benefit. Are you audible now? Okay.
Yeah, audible, Doctor. Yeah, audible. Continue.
So is my explanation clear now? Okay.
Yeah, please carry on.
So, to differentiate the retinal pathology from that, if there is a macular problem, even if the patient looks through the pinhole, he will not be able to see more than what he read earlier. Or if you have not read anything, he will not be able to see more. So this is a very simple technique one can incorporate in their daily clinics. Just when they say something about my vision is problem at stake, I have no much vision in one eye. So you can definitely identify. And also when it comes to see retinitis pigmentosa. Retinitis pigmentosa is something the pigments are affected in the eyes. It's an old term, like it is nothing to do with inflammation, like what you see in the name retinitis. It is nothing to do with any retinal inflammation, but the term is actually by mistake it was developed in that way. So the retinitis pigmentosa is a pigmental change which happens through mostly through a genetic disorder, genetic problem. By gene itself, their pigment formation is at stake and they are not able to develop the pigments in the retina. That affects more from the rod cells. The rod cells are actually, which you know that it is responsible for the dim light vision or night vision. There will not be any color in that vision. You will be able to see only through the rod cells that black and white images are visible. So when that rod cells are absent in retinitis pigmentosa, what happens that peripheral vision starts decreasing. So when the peripheral vision is decreasing, that means the amount of rod cells from the periphery starts decaying. So that field of the vision comes to a tunnel-like image. When a patient wants to see to a laptop, he has to look like this. At the same time, if he wants to see on the side things, he'll have to turn exactly to point to the center of the eye. So that way, it is called a tunnel vision. So this can be identified by asking just in front of the patient. You just ask him to cover the other eye. So whichever eye is we are examining, you have to ask the patient to cover the other eye. Like I told you earlier, completely cover the eye without having any vision from that eye. And you have to move your finger. Point a thing, pen or something in front of the patient, and you have to horizontally place your finger and make a movement. It start from the periphery. So generally we get about near about 360 degree, almost 180 degree vision is there almost. So you have to start from the main periphery and how far you are able to see. So the area where you are able to see. So sometimes if it is advanced, the patient will not move, say anything. I am not able to see anything. So we'll see only when it comes to this area. So that means that much power, that much visual area is affected. That much field is affected. Visual field is affected. So that way you can easily identify that. And there is a refractive errors and other retinal pathologies I told you, the pinhole experiment. The pinhole examination can definitely differentiate between a refractive error problem with other retinal pathologies. And now all these things are without use of a ophthalmoscope. All these three or four things I told you, that is, you need not have to have even an ophthalmoscope. Once you have an ophthalmoscope, generally a physician, it is wise to keep an ophthalmoscope just to have it, because that has got both heads, ophthalmic head and also for the ENT examination also one head will be there. So this ophthalmoscope, the light will be there. That ophthalmoscope, the light can be placed into the eyes by closely going into the patient's eye, and you can examine the eyes. And if the lens light rays are not going into the eye, you can assume that either it is mostly it is a cataract eye, or there is a vitreous problem, or there is a vitreous hemorrhage in the eye. If it is a case of diabetes, long-term diabetes, it is a vitreous problem. And if there is a macular defect, also you can see the red glow of the eye will not be there. The eye will be looking mostly pale one or yellowish and pale appearance in the eyes. So that can be differentiated with the examination of ophthalmoscope. And also, glaucoma early signs or changes in the optic disc can be observed through an ophthalmoscopic examination. If you do the direct ophthalmoscopy, if you go closer to the eyes and about 15-degree deviation, if the eye is like this, if you see from a 15 degree, very close to the eye, you have to almost touch the ophthalmoscope head with the patient's eye, not touching it, but from a 15-degree angle, if you look, you are straight away looking into the optic disc. And from catching the optic disc, you have to move wherever place you want to go. If you straight away in the right eye, if you are examining the right eye, if you straight away move to the right, you can see the macular area. A slightly dull macular area you can see. If it is again, you have to come back. Wherever you go, you have to come back to the junction, which is called optic disc. Then only the vast area in the eye, which is magnified about 10 times, can be viewed through the ophthalmoscope without confusion. So you can specifically and precisely see about 10 times magnified image of the retina fundus through the ophthalmoscope. If there is a power variations in the eyes, if the patient is myopic, if the patient is hyperopic, there are adjustments to make it into hyperopic or make it into myopic. That can be adjusted. If generally the red mark, 1, 2, 3, 4, 5, 6, 7, 8, 9, like that it comes. You have to turn on this red side, it becomes myopic. You will be able to see the myopic eye. If it is a plus eye, you can come to the black numbers, 1, 2, 3, 4, 5. Accordingly, if you turn it, you can go to the, you see clearly the hyperopic eye as well. So the changes, the signs or changes in the optic disc is actually a cupping. A cupping in the optic disc can be easily understood with an examination, close examination of the ophthalmoscope. So in general clinic, if somebody complains about eye pain or lower visibility or poor visibility in the night or glare happening in the eyes, when a vehicle comes, I cannot drive anymore. Such complaints that can happen due to high intraocular pressure. It can happen through corneal edema, which is caused by high intraocular pressure for few weeks. So that stage you can definitely identify. There you can find some of the corneal cells are just like what we soak a piece of paper in the water. It becomes slightly lucid and it becomes slightly folded things. So the corneal layer, you can see the luster of the eye is no more visible. A cornea slightly feels folded. There will be some folded areas in the cornea and the light will not pass through. That is a swollen cornea. So that swelling mostly happens with a high pressure or with some trauma in the eyes. So this differentiation can be understood clearly with the examination of the optic disc. The disc cup will be there. The disc cup is evaluated as 1, 2, 3, 4 like that. Normally it will be around 2 to 3 cup disc ratio, CDR. So the cup will be this much, and in the middle you will have a cup-like formation. So this, if the cup-like formation is expanded to the entire circle of the optic disc, if the optic disc rim is very thin, that means the cupping is too much in the optic disc. The cup actually is the opening of the optic disc sheath. Optic nerve is opening into the eyes through the optic disc, and it spreads to the just like a cable of wires, hundreds and thousands and millions of wires. Actually, they are spread to the entire visible retina or neural retina. There is almost 2/3 of the eye is covered with the neural retina, and the remaining part is only blood vessels. So the anterior portion of the eye, there is no neural retina. There is only blood vessels are there. Only the posterior visible areas only are becoming neural retina, where we can see. That is why we are able to see this much and this much, too much up and down. The field of vision is because of the neural retina presence in the eye. So when the cupping is happening, that indicates the corresponding peripheral retina is shrunk. when the cupping happens more and more, the peripheral retina, neural retina is shrinking and it is destroyed. It is devoid of blood and it becomes damaged and irreversible damage occurs. So this early sign of glaucoma can clearly be predicted by a clinical practitioner in a general clinic if he closely examines the optic disc rim and optic disc cup. So that can be easily made understood by a direct ophthalmoscope. Then ocular migraine. If some of the ocular vessels are dilated and sometimes suddenly the patient complains about sudden loss of vision for a while, then it comes back. So it's mostly due to the migraine, ocular migraine. So those things can be identified. Sudden vision loss and recovery after 1 minute, sudden blackout and recovery is there, happening there. And also with the migraine of the migraine headache, if there is a migraine, if the blood supply to the eye is affected in that migraine affected areas, so the blood supply to the eye also gets affected. So the pressure to the pumping of the blood to the eyeball is affected, and that also can cause some dullness of vision or fogginess vision or blackout for a while. So this you can identify with a simple interrogation with the patient and seeing their symptoms. And sinus-related eye disorders is very important in a general clinic where we have to resort mainly to our main important treatment called Nasya Karma. So the not many eye diseases, they are not eye diseases alone. They mostly happen through nowadays the current day-to-day eye strain, eye itching, eye pain, photophobia, like difficulty in looking into the light, bright objects or laptop, and unwanted fogginess of the letters. If a patient is less than 40 years, normally the 40 years presbyopia starts. But if this particular patient age 25 or 28, he says that I am unable to look at the computer for a long period, my eyes gets watered. You don't have to primarily go to an eye disease. You don't have to think about an eye disease. You can ask for some complementary symptoms developing in the patient, whether you have a sinus congestion, whether you have a heaviness in the forehead, is a bowling. So, whether you have a nasal congestion, nasal discharge is there, watering through the nasal watering is there, or what you call pratishyaya, or excess watering in the eyes because of the dendra, the pores in the eyes are blocked with kapha. So that gets closed, that gets blocked, and excess water will fall down. And sleepy, patient always feels as when I open a book, I feel sleepy. As when I open the laptop, after 5 minutes, I feel sleepy. Those things are actually, it's signs of sinus congestion. So that can be a lot many eye problem, what you call camouflaged eye problems can be kept away with simple use of tarpana and tala, the medicines which are used in the head, with the smoky, the dhumapana, and nasya. These things, and avoidance of cold, avoidance of cold items, water, refrigerated items, use of dahi to be venkarna, such sinus-related management can save lot of problems. And some of the patients do develop presbyopia. Presbyopia, you can understand, as I told you earlier, about 40 years of time. It is natural to have a hardening of the muscles, the eye muscles, the ciliary zonules, which holds the lens. That actually zonules and the muscles, tiny muscles in the eye, actually make the eye lens contract and relax. When it is contracted, we are able to see nearer objects. This all happens in an involuntary way, because once you start focusing into a near object, eye automatically contracts the lens. If you look at far away, eye naturally relaxes the lens. That becomes more towards minus. When it contracts, it becomes more towards plus. the lens becomes more convex. When it is relaxed, it goes to flat. It flattened and goes to minus again. So this is designed, or actually our eyes are designed for seeing beyond 20 feet, that is infinity. So eyes are designed to focus beyond infinity, and it's a universal focal, what you call all-point focus. It can focus anywhere at the will of our eyes and the mind, because the mind is very fast in decision making, and you can at the any moment, whenever it comes, you can focus into that. On to the far away, you can focus there. So the reason why we are asking the children not to use the mobile is this one. When you start using a mobile, you are using it in this is about hardly 20 centimeter. When you are using a book, you are using in about 30 centimeter. When you are using a laptop, you are using this about 50 centimeter. So that much accommodation, the lens accommodative power is reduced or relieved when you start seeing a laptop, or if it is better in seeing in a TV. TV, you can see a long distance, maybe around 10 feet or so. So your eyes are more relaxed. So if somebody is starting using the mobile for 5 hours, 4 hours continuously like this, is throughout that time his eye lens is contracted and accommodative spasm happens. The eye becomes stagnant with that muscles in the place like this, and the lens also becomes like this. So it takes more time to relax. Rather than going like this, it will take more time to relax. It needs a lot of effort from the eyes to make it soothe and to relax. So slowly the eye stagnation, the difference of the eye movement, the lens movement reduces. So when an age comes to about 40 years, this naturally happens in our body. The zonules and the other ciliary muscles and all becomes harder, and the lens becomes very hard. And there will be some calcification in the lens occurring naturally over the period by rusting, because we are all the time we have been exposed to light and sunlight and artificial light, everything is there, heat, so many climatic conditions. So the eyes lens becomes more harder. So this accommodative power of the lens reduces. So that makes you actually presbyope. So that the place of the lens has to be given to a artificial lens. The whatever lens power you have, suppose it is called a vertex distance. The distance of a glass from the glass frame, and this is our eyes. So there is a difference of power of this lens from the power of the eyes inside, lens inside. So in simple way, I can say, you might have seen various operated eyes and the lens power attached to it. So normally, this happens with about minus 20 or minus 18 diopter. That is the actual power of the lens, which is placed in our natural socket inside the eyes, anterior chamber. But that is calculating with the distance of the macula and the lens place. So in that place, if you are placing a lens, you will be using about 18 diopter. But in the same way, in older times, about 30 years back, the intraocular lens was not regular. It was not invented. That time we were used to have external glasses. We call soda glass. We call thick lens glasses. So that power will not be 18 diopter. That is generally limited to 10 diopter only. About 8 diopter is cut. Why? This distance, vertex distance is covered. From the natural eye lens, we are using an artificial lens which is placed further in front. So when you take a lens and going near to the object, that becomes more dark. When you bring back the lens to our eyesight, this becomes smaller. So that way, when the natural lens is not there and we are using an external lens, the power of the lens becomes plus 10. So that way, the the vision is maintained and the pre-operated vision status is almost maintained in earlier times. So that is more sharp. About 99% visibility is regained from an intraocular lens. Advent of intraocular lens and placing it on the previous place alone. The disadvantage of the intraocular lens is that it cannot anyway go accommodation. It cannot accommodate. It cannot contract or relax. So that is the disadvantage as of today. There is no lenses invented which can accommodate to the near point and far point. So that we have to use various varifocal lenses, which will be one number here or zero number here, then slowly plus number is added, and full correction of the accommodation, which is called 3 plus 3. Plus 3 glass is actually given to that. Okay, that is a different point of that. So presbyopia you can understand. When somebody is saying about not able to read, you should not think that it's a major Wilpic disease and refer to it. You just ask them to get a reading glass correction. That is the presbyopia age. Or computer vision syndrome I told you. When somebody is keep on looking into the computer, laptop and mobile, his muscles get stagnated and that causes a lot of kshina or lethargic in the functioning of the lenses and spasm in the lenses. So that you have to understand why it is happening. So there are eye exercise. There are many exercises you might have heard in the general advisory, that swinging ball exercise. Then black and white lines, eyeball is there. Then covering each eye, just like rotating the eyeball like this, all the places. Again, anti-clockwise. There are so many exercises are there, but effectively what happens after a few days, the patient stops everything because of the frustration. When there are too many exercises, everyday life, it is very difficult to manage. So instead of that, the most important part of the exercise can be advised to the patient that looking into the near point and to the far point. So that is the best exercise we can give. So that gives exercise to the rectus muscles, lateral rectus muscles, and also the other ciliary zonules and the lens also to work more and more rapidly at your ease by doing this exercise. So this exercise also can, to certain extent, prolong the use of a glass in a presbyopia. So those exercises can be, you can advise to the patient. I'll just give you a show about that exercise. You seeing now?
Yes, sir.
When looking at a far point. Again looking at it, it's about 3 to 4 seconds. Then looking at ROE is about more than 20. Very simple to follow. So many actions, so many time consuming consumption can be released, and you can easily do it from the at home. So eye exercises, that is actually, I'll once again show this. It's very easy to follow. Like you ask the patient to look in a balcony or in a veranda. So ask the patient to look at a faraway tree or coconut, whatever available in the faraway. Ask the patient to look at the faraway point. 3-4 seconds. Stare at that. Some people may not be focusing that because of the problems. So that is okay. Ask them to maximum stare at the object. Then after keeping 3-4 seconds, ask the patient to look into the fingertip. Both eyes. It should not go like this when you look into the fingertip. You should be careful enough to observe that it is not going like this. Okay. Only the both eyes should converge. So that also teaches you how to converge. There will be many people who are not able to look like this. They will be just looking like this only. However way you tell them, they will be looking like this. Their convergence convergence is very low. For them also, this can be easily practiced, and slowly they become more able to converge their eyes. So they look at the fingertip, blink your eyes. Otherwise, you will end up with a headache after 2-3 times. Then far away. Again, looking at the fingertip, both eyes. Blink your eyes, look far. So this way it can be repeated for about 25 times. So that is a very easy method, very fast result giving. Because once you do it for about, it takes hardly 1 minute or so. So that actually gives you more power to see near objects or more clearly. Or the strain, even by using glasses, can be minimized. Or those people, those who are 39, 40 years old, they still can manage without glasses. So the muscles get more strength and they are more able to accommodate it. So in the if you have a professional, IT professional or bank officer, nowadays the bank is exclusively on computers. IT, not only the IT professions, many professions are on computer, stock market. They are without blinking, they have to keep on watching the computer screen, laptop screen. Even doctors also nowadays, they are more on laptops. So for them, a 20-20-20 technique can be advised. What is 20-20-20 technique? 20 technique is that first 20 stands for 20 minutes of work. After 20 minutes of work, you have to close your eyes for 20 seconds. Seconds, 20 stands for seconds. You have to minimum 20 seconds, you have to close your eyes. Keep your palm over the eyes. Get the warmth of the eyeball. You have the palm of the eyes becomes warm when you just rub it and just keep it. It's called palming. So this gives enormous relaxation to the muscles. They get more ease. They are more able to function further. So that gives a 20 seconds. You can rub it. See, just like doing in the eye massage. Ask that particular thing to be done for about 20 seconds. Then many people are sitting in a camp. Small cabin. So they may not have any other thing. So they have to stand up. They have to look at a faraway object for a while. Okay, then 20 feet far away. So that's the third 20. So 20 minutes work, 20 seconds closure of the eyes, and 20 feet far away. So this is the regimen which has to be followed by every IT professional, whoever works at computers. So that will relieve a lot of eye-related computer vision syndrome, so many problems in that. So that's one major advice we can provide in your, because not only for the vision problems, the computer vision syndrome nowadays is also it's a package, like it has got a finger problem, always keeping on the keypad. Then your wrist is affected. You are keeping the wrist in a degree, like always, and shoulder is there. Shoulder is stagnated. Your elbow is stagnated. The more joints are not there, moving there. And moreover, you are turning with your rotating chair. So the movement is also affected. So you are not properly moving. Your knee is affected. Your hip is affected. Your legs are less powerful. So these all things happens through a computer using, or simply idly sitting and doing a job. So that has to be relieved through simple methods like eye exercise and 20-20-20 methods. So these are some of the simple remedies. You can use it in your OP clinics and home. So that's whatever eye treatment. Eye treatment has to Ado Dhara. Dhara has to be, or Sega. Netra Sega is the first treatment to be performed into the eyes. So that's the one thing you can always use. And for a Dhara, many people used to tell me that they are using Dhara, Tripala Dhara. Okay, it's fine. Tripala Dhara is fine. But Tripala, more than Tripala, if you add these components, HT Madhu is there, Glycyrrhiza glabra, Gairiga is there, that soil, red soil, Lodra is there, Vasha, Adathoda Vasika, Darvi is there, and Draksha. So these things are actually Tridosha Shamaga. Tripala, Tridosha Shamaga is there. It's It's a Karshana also. Eshtimadu is a Pitta Shamaka. Gairiga is again Karshana. Lothra is Pitta Shamaka. Vasa is Pitta Shamaka. Darvi is very much antibacterial and antifungal activities are there. Darvi too. Drashta is also Pitta Shamaka. So eye being an organ broadly affected by Pitta. So these are major Pitta, anti-Pitta properties are there in Dravyas. So these combination can be of very much help. Even right from the itching of the eyes, it immediately cleanse your eyes and get rid of your itching, severe itching, watering of the eyes, strain of the in the eyes by seeing the mobile or computer, and photophobia, not able to see the light. This gets out. This photophobic pain of the eyes, foreign body sensation of the eyes. That generally gets away. And even if some dust or something is there, that gets washed away with that. I'll get a small video about it. Kashaya Dhara. That I showed you in the earlier. Kashaya Dhara procedure I showed you in the earlier. And another relaxation method, what you can definitely do in your OP, in your treating along with your treatment side is a Shashtika Pinda Mardana. Just have a look at it. After the initial massage with the it also gives something very refreshing treatment. Happy that many people are now doing this with the knowledge and whoever has come to me the knowledge without all types of protein very and this actually it also helps in patients with Kentoconus patients. You get a lot of improvement in their vision. Shows a specific improvement in the vision as well in the Keratoconus cases along with other Sarpanand.
Excuse me, doctor. Due to the music, we can't hear what you said. As due to the video music.
Should I cut off the video? I mean, audio and show that, say that once again, or I'll just.
No. You can explain, doctor. You can explain what happened in that procedure. Okay.
No, video was clear, I think. Okay.
Yeah.
So the video is a presentation of an innovative treatment what we are doing it here at Sudarshanam for the management of astigmatism and for myopia and especially in keratoconus. So I was telling this bolus is made by Sathe Chawan, Shashtika Anna, and Shashtika Anna is dipped in a milk which is boiled with Dashamula. So Dashamula Kshira is boiled and this small pouch of Shashtiga, that cloth actually is dipped into that warm milk, and the heat is actually tried from the therapy hand. Then that is used for the massage. So this massage, this rotary movement and the massage actually gives immense soothing to the patient, and the muscles are relaxed, and the pain of the eyes get rid of the pain very fast, and the strain is relieved. And this is more actually affecting the corneal curvature. The keratoconus, it is a conical cornea. The cornea becomes conical and it bulges to at some point it cracks also on the cornea, that becomes more fatal. And sometimes it needs for a corneal replacement, transplantation, keratoplasty. So in such cases, in earlier stages, in order to prevent the progression of the keratoconus and prevent the progression in the short sight or astigmatism, this treatment is very helpful. We have been doing this since 1995. And I was saying that nowadays, those who have come to us and seen this treatment, they are doing it in the colleges, various colleges and all. They do this Shashtiga Pinda Mardha Sweda. At the same time, it relaxes the muscles with the Sweda, and also by massage, it manipulates the corneal surface, and also with the use of anti-vada properties in the Shashtiga and the Vesamula Chira, it helps the muscles to strengthen. So this is a very unique treatment which is followed here since about more than 25 years. That is what I was saying. Is that okay? Clear now?
Yeah, thank you, doctor. You can continue.
So these are the videos which I wanted to show. And now Tara or Sega is there. Triple Ishtimadu is being used for the use of coriander water. Coriander water is a very magical medicine which you can always use in many conditions. Like coriander is very easily available, and it's every household has that stock. So coriander seed can be just boiled in water, plain water, and that plain water is filtered. Otherwise, the coriander will have some small thread-like this thing that will irritate the eyes. So this is filtered, and lukewarm coriander water can be given for many conditions in the eye, like itching, mostly in the redness of the eye. Some allergic redness happens, some madras eye, red eye, what you call conjunctivitis. Even the keratitis, corneal conjunctivitis also. Conjunctivitis also affecting some of the viral conjunctivitis affects morely on the cornea. It leaves on marks in that. To avoid that severe infection of the eyes, this coriander water is very much useful. And honey, of course, everybody knows that honey is a very good healer of the eyes, and it can get rid of so many unwanted kapha in the eyes. It can open up the spores in the eyes, randras, what we call. That can be opened up, and eyes functions can be improved with simple use of honey. And another thing is the use of castor oil. Castor oil is something very easily available and very emergency kit-like thing. You have to keep in the household or in your OP. Itching of the eye, severe itching of the eye, eyelashes, krimikaraka. And because of the dandruff and other things, eye itching is a very major problem, especially in sinus congestion. It happens. And some krimi also it happens. So all these things, the itching, the property of itching can be very well made vanished with the simple use of rubbing the castor oil in your finger and rubbing it over the eyelashes, not on the eyes. If it touches the eyelid, if it touches the conjunctiva, it causes little irritation. Nothing much danger, but it causes little irritation. So you can rub it. It's not a massaging, it's a rubbing. You take it in the fingertip and rub it over the eyelashes, and on the lower lashes also, border of the lower lash also, you can rub it, right from the nasal canthus to epicantthus to this lateral canthus. So this can be rubbed for 2-3 seconds and left it. Immediately the eye itching disappears. Of course, we will have to go for the nasya and other root causes also. We have to get rid of the kapha from the channels, which causes basically the cut. So this can be used as a primary thing and very sudden action medicine, the castor oil. and Dashamula Chira. Dashamula Chira, the Chira in itself is a very soothing agent for eyes. The Chira, simply if you just boil some Chira and put little bit sugar in that or jaggery in that, and that Chira alone has a lot of soothing effect in the eyes. That can be used as a lukewarm hara, sega in the eyes. Just like how I showed you in the video. From the nasal canvas, you can slightly incline the face like this and put the from about 4-inch, 3-inch like height, you can put the pour the water, hara, milk, and wash the eyes. You have to keep the eyes widen as long as possible, as much as possible. And this can be added with Dashamula in the Shira. Dashamula in the Shira is famous thing for Vata Haratva. So the pain and muscle weakness, these things, the Dashamula helps a lot. So the Dashamula Shira, you can do it to your normal Kashaya Dhara, Sega. Besides the Triphala combo I told you earlier. So Netra Sega you have seen, and Nasikarma and Shashtika Netra Abhyanga you have seen. And when it comes to simple examination in your OPD, in your examinations in the OPD, I told you earlier, you have to have each eye separate before going for a vision examination. Then only you will come to know what is the vision in particular eye, whether the right eye, left eye, whether he has got a stereo vision. What is the stereo vision? Stereo vision is one is mono, this is mono. When two monos join together, it becomes stereo vision. The depth of the object, the distance, everything is clearly understood with the function of the both eye. When the both eyes goes to the image, then only the 3D effect is happening. Otherwise, there won't be 3D. If you look through a man who was looking always through the both eyes, suddenly close the one eye, and if you want to knit the needle, you cannot put thread into the needle. That correct lens will be mistaken. That is only happening because of the both eye vision. But if you ask, there are many people with one eye, those who can easily do that. That is because of the practice. The brain gets acquainted to that one eye, and it makes more easier for them after a year or so. They become more, even with the one eye, they can do the thing. So generally, the stereo vision is done for the 3D perception of the image by a particular angle, and it looks into the image. So this has to be done with each eye, and there is a cover-uncover test is to know whether he has any lack of stereo vision in the eyes. Alignment is very much, if the alignment is affected, whether the patient is using his both eyes to see one object or whether he is only using one eye, you can easily identify by cover-uncover test or alternate cover test. Suppose alternate cover test, I'll tell you. So we ask the object, we show an object either nearby, or you can also ask in the vision chart. Look at the vision chart, and you have to ask the patient to stare to that particular point. So when a doctor sitting in front of the patient and the patient is looking to the board, you are covering one eye, but at the same time you are able to see the covered eye when he is using the normal eye. The opened eye when he is looking into the object, where is the covered eye going? Whether if it is going, deviating from that, that indicates that he is developing a squint. He is developing a divergent or a convergent squint. So in the exotropia, it happens when you cover one eye, that covered eye may deviate, exotropic movement or esotropic movement. It may come into the nasal side. That you can assume that this particular patient does not use his both eyes for looking an object. So that is to be noticed. And if you are taking away the cover-uncover test means cover, then remove it, whether it is coming to that. Again cover, whether it is going away. So that way you can understand the severity of a squint, or you can discover a squint is there, which is hidden, which the patient may not be aware. So if you come to know that, if you can make the patient aware that you have a tendency to develop a squint, and that can be cured, or that can be cleared, that can be reduced, and you could make him see the things in an aligned position with both eyes through simple techniques or tarpana or simple techniques of eye exercises, massaging. These things can very much help him in an early stage if you understand this in your OPD. Red reflex test is something very important, which is we have primarily done in pediatric OP. Pediatric OP, the newborn or neonatal. In the first examinations, the doctors used to put the direct ophthalmoscope light reflects into the patient's eye. And if that eye, because the tender eye will be very much transparent, entire passage should be transparent and the light goes into the retina and touches the retina and comes back, hit back to the ophthalmoscope or to the eyes of the doctor. So that glow is not there in the eye. That will be easily understood with the ophthalmoscope, flickering of the ophthalmoscope into his eye. So the glow is not there. There are so many reasons. When there is a cataract, Balakaja is there, there may not be a reflex, the light will not get into. If there is a corneal opacity, the light will not get into. If there is a huge, macular absence is there, choroidal degeneration, the most posterior area of the retina is choroid, and it's a astigata area, padala is there. So if the choroid is coming in front, there is no retina, there is no pigments in the eye, this reflex will not be there. Retinal blastoma, it's a very severe problem, very fast developing eye condition which needs a removal of the eyes. In that, there will not be any vitreous or any retinal layer at all. So there won't be any glow coming from that eye. So these things can be ruled out in the neonatal babies through a simple examination called red reflex test using a ophthalmoscope. And even with a torchlight, you can also find out some of the reflexes in the eyes. Pupil reflexes can be that. Immediately, once you put the light, the pupil should shrink. Okay, then constrict, and you have to, when you remove the, it should be in a fairly darker room, not entire dark, a little darker room. If you put up a torch from the side, you never put the torch to the macula, straight to the eyes. You should definitely keep from the sides. You should not put a torch, especially the Chinese-made LED torches and all that has got a very bad rays, violet and other green things and all. So that is not a good idea to place torchlight always. Never keep the torch straight to the eyes. You have to keep it from the side, and you see whether the pupil movements are okay. But if there is a accident happens and your nerves are affected, this has got an opposite movement. When you instead of pupillary constriction, this will dilate. When you put up a light, this will dilate. That is called RAPD. Pupillary defect. That is afferent pupillary defect. So the nerves conducted gives a wrong message to the brain and does the opposite action. So that happens mainly when there is a broken third nerve palsy or sixth nerve palsy. This happens. So these things can be understood from a torch examination. Or mature and hypermature cataract, this can be detected easily with a torch exam. You can see the white, very white cloudy thing, lot of thick clouds like lens instead of a glow in the eyes. The light torchlight will not reflect you a glow. Rather, it will give you a white, dull feature in the front of the eye. So you can assume that it's a mature cataract. Even elder people, many people do come with that saying that night it is very difficult to travel and the things are very foggy, just like a cloth in front of them. They see the things. Those things mostly happens with a soft cataract or a mature cataract. Or even some people comes with a corneal swelling and eye pain. That may be hypermature cataract. After a certain time of maturity, the cataract grows within and it can cause various other problems in the eyes, and even sometimes the eye organ itself may be at stake. That may have to be removed. Okay, so these things can be detected in a general OPD condition. So these are the simple things we can have use in your daily OPD, which can avoid a lot of embarrassments, lot of financial burdens in the patient in a long run. So, what are the strengths and advantages of Tarpana? The Tarpana, when it comes to a Tarpana, many people say that I have a problem and I treated the patient with Tarpana. Tarpana alone, it is not a, it's a procedure which is explained in the text. The medicines which are used for the Tarpana, the ghee, which are how is it prepared, that is gives you a very important role. So that makes you more sensible in treating various kinds of refractive errors and other things. So that is a very important. The dravya which is used for the tarpana. Tarpana, the dravya which we use is mostly many people will suddenly say that I am using Jeevandyal. Some people will say the Mahatraipala. Some people will say Jeevani or Vidariya. So these things are all okay, all fine. Tarpana has got 2 to 3 types of actions in that. One is the weight of the medicine, the gravity of the medicine, which is placed about 5 to 10 ml of ghee is placed over the ice. That has got a gravity on the weighing aspect itself. Then the property of the ghee. Even if you use a plain ghee, that has got a property, medicinal property, which can soothe the eye muscles and also gets clear vision and all. And if you add up some medicines, which are of course has got a Vada Pittahara property. So Jeevandyadi is Jeevaniya Gana. Jeevandi Kagoti Medaka Mulka Mashwarna, Vishwaka Jivaga, Madhu and Jeligano, Jeevaniya. Or Tulam Pajeda Jeevandyam. That is a Jeevandyadi ghee what you get. 100 tulams. Tulam is used, the weighing measure is there. And there are other medicines which are used in the Jeevandyadi. So what we use here, we have made a medicine which have been in use for about 3 decades now, which is found to be very much useful, and especially in the refractive errors. Majority of the cases, about 90%, more than 90% of the cases, do have a good visual prognosis in refractive errors. All through the years, what we have found. The failure rate is very low, that either the patient keeps the vision or mild improvement. Marginal to extremely well improvement status is mostly seen with the Tarpana, the ghee when we use as a half quantity of the Jeevandi, and the Samula is used. And this particular combination about preparation, if you make the preparation out of that, Tripala, this is more useful in the management of refractive errors for using as Tarpana Dravya. And of course, there is a diabetic retinopathy note. This is not, do not apply. Diabetic retinopathy, we need further more Rakta Pittahara Dravyas and Pitta Shamaka Dravyas, where Lodra Vasha, the combination that also been pioneerly, we are actually making a use of it by changing the combinations of the yogas. So Lodra Vashadi is used, and Sadahvali Tarpana Krita is Ashtanga Yoga itself. Majority of the eye external problems, corneal problems, allergy, so those things can be get rid of such problems by use of Sadahvali Tarpana Krita. So it's very easy to use actually. The Tarpana procedure, as I told you when I showed you the initial video, I have shown that clearly about how to reduce the making of the Tarpana, the well, so the pool walls are made. It's very simply made with lesser masha, this thing, paste and supported with a thick cover paper. The cover paper which you use for cover the books. So that is cut into a small cup shape, half cup shape, and that is placed over the eyes. And that, on the support of that, the amount of masha needed will be very much reduced. So you can easily cover it, and up to this, you no need to put it entire eyes and make it a big laborious job. And lot of Dravya Nashta is there, effectiveness is low, and the ghee amount is very much wasted. A lot of ghee gets locked up here and without any use. The ghee should be locked mainly onto the eyes portion, not onto the canina. Okay, that has to be taken care of. Whenever you do Tarpana, you have to see that the ghee is not kept over here. It should be equally It should equally be covering the eyelashes up to eyelashes level. It has to equally cover. So that way it gives more effect to the visual problems. So the newly formed eye diseases, sudden formation in the eye disease, new cold, or a Kabja disease as a whole, they are all exempted. But majority cases you can definitely use. All chronic cases you can use the Tarpana very judiciously, no problem with it. Dull climatic conditions, as you know, and including cloudy weather, extreme cold and extreme hot weather. So what we do, we use it as a standard protocol now that to keep the temperature in around 28-29 degrees with the help of an AC, and that is maintained, neither not going to the extreme low, neither going to the extreme hot. So this temperature is maintained, and the order of the room, everything gets low. Earlier, we used to have in a closed hall, when we use the Tarpana, lot of bad odor comes out of the key and other things into the room. The room is suffocated. So now this is get rid of that suffocation in the room, better comfort to the patient, and the temperature is maintained. Whatever temperature outside, we don't have to much bother about it. We get into the next room and then go out. So it doesn't cost much this thing. If you are doing a eye treatment, it's always better to ask the patient to keep away from the light by using a simple plastic black glasses. Dark goggles can help them cut off the light too much, which is actually the many problem for the activities of the eyes, because the photoreceptor cells in the eyes are there, so they get activated with the presence of light. So maximum you cut off the light by giving a dark this thing. So we don't find too much because covering with a lotus and other things and all, maybe ideally good, but practically they are causing a lot of tension in the patient, discomfort, and even depression also. And practically it is not possible to keep the eyes always throughout the day with the deep lotus flower. Okay, so the dark glasses gives enough protection to the eyes, and it shows very much positive response from the patient. So these are the Herzberg test, actually alignment test, whether we do just simply understand that how the eyes are aligned or not. Even there is a normal eye, the alignment actually should be in the middle of the cornea. When you put up a torchlight, the both eyes should give a same pattern of light reflex in the center of the cornea. So when there is esotropia, one eye gets medial. So the reflex goes away from the outside of the eye, outside of the pupil. And if there is a exotropia, the one eye reflex is getting into the nasal side. Oh, and there is a hypertropia or hypotropia. Similarly, the reflex goes up and down. So that way you can easily understand whether these eyes are aligned, whether the patient is able to see properly with both eyes together, and he is seeing this one object with both eyes. So that way you can understand these eyes are emmetropic and also anisometric, and also there is no esotropia or exotropia. Emmetropia is there. Red reflex test is a leukocoria. That is white pupillary reflex happens, maybe due to as I told you, the cataract, or maybe another vitreous problems. Vitreous thickening also can cause you a leukocoria, or retinal damage or choroidal damage can cause you a leukocoria. It's a transmission of light from an ophthalmoscope through all the normally transparent parts of a child's eye. So the tear film, cornea, aqueous humor, crystalline lens, and vitreous humor. All these things I told you a bit earlier. So the light reflex should come back to the examiner's eyes. That is the success of the test. The eye exercise I showed you earlier regarding looking near and far away objects. Eye massage. I think eye massage I did not tell. Eye massage is a technique where you can always use a simple, effective method to relax the eyes. Okay, welcome. Okay. Cerebella oil is taken in the hand little bit and rubbed it, and that is used for eye massage. Okay, hardly you press it somewhat harder around the eyes, over the eyebrow, below the eyes, this way. This is repeated for about 1 minute or so. So as a regimen, daily regimen, you can always use that. It's a massage technique to, especially in the pentagonal people, astigmatism people, children astigmatism. This is very helpful. So this is in short what as a clinician, I could tell you some of my techniques which are used in the clinics and which can be utilized by a general practitioner as well. Okay, hope you could enjoy the talk, or if any doubts or anything, you can ask me in the time is there. So whatever limited knowledge I have, I will try to explain. Thank you so much. Thank you once again, Naina, for getting me a wonderful opportunity to address you all. Thank you.
Thank you so much, sir. It was really a wonderful session. Now the session is open for discussion.